my paper is on screen or not.
Yeah, please.
Is it on screen, sir?
Yeah, you share screen.
Yeah, can you see that, everyone?
You have to share it, sir.
Yeah, okay.
You share.
Yeah, fine. Thank you very much for assisting me over. Fine. So, first of all, let me start by thanking KQHDA for giving me an opportunity and having me on your platform. Dr. Patel has started well with conch blowing. I thank him for bringing a positive vibration into the presentation. I thank Dr. Swami, Dr. Shubha for assisting me over. And I thank you very much, Dr. Shripad sir, for inviting me over to your platform. And as usual, I'll thank my Sri Sai Ram Homeopathic Medical College, the management, principal, teaching, non-teaching staff members, and my lovable students. Of course, everywhere I'll thank my patients also for teaching me the art of homeopathy. Yeah, the topic, as I said in the beginning, bearing one organal lecture is difficult for everyone. So now we are presenting two organal lectures here consecutively. I'll try to make it as crisp as possible. Hopefully, this presentation will be a superficial one because I'm limiting myself to a prophylactic side. But it's not a regular prophylactic session in organal that I'm going to do. It is more of utilitarian oriented homeoprophylaxis. The idea came to my mind, so to have a paper on this utilitarian homeoprophylaxis, because as an organon student, we might have had so many sessions with your organon lecturer regarding what is the view of homeopathy and what are the prophylactic methods that we have in homeopathy and how practical it is. But when you start practice for many years and when you teach homeopathy for many years, you will face, as a practitioner, you will face so many questions. As a teacher, you will face so many questions from the students. What is the stand of homeopathy on vaccination, prophylaxis, immunization, so on and so forth? The patients visit your clinic. Most of the time, the pediatric cases, the parents are so anxious. And you know, the modern parents, the qualified, so-called educated, internet-oriented, Google searching parents, so they have their own set of questions and how safe is vaccination, kind of things you'll have, right? Such questions will be asked by parents, patients, and physicians. The plus point that I observed, I have around 22 years of my experience in homeopathy so far. After practicing so many years, now we have, it's a good sign, I'll say, in homeopathic practice. Even the allopathic modern medical doctors, they started visiting homeopathy and they started recommending cases to a homeopathic doctor. This is a good shift I invite, and hopefully most of the practitioners are also having such experience. So these physicians also started asking, what is your stand? What is your stand on homeopathy regarding prophylaxis? Now, a small introduction, don't worry, I'm not going in deep about the Heinemanian views on prophylaxis and all. It's just a superficial view. We all know Heinemann, the master, because master is the first. Okay, he has expressed his views on prophylaxis way back in Friend of Health, Effects of Coffee, Prevention and Cure of Scarlet Fever, first year, right from first year till final year, and your MD classes, you have come across all these essays written by our master. And the most favorite to every student is aphorism number 3 and 4, especially the fourth one. So on and so forth. Heinemann has expressed his views on prophylaxis in various aphorisms or footnotes in his masterpiece, Organon of Medicine. Of course, the pioneers, the followers of Heinemann, also supported the prophylaxis. So in a nutshell, we can conclude homeopathy is not against prophylaxis. Of course, every rational medicine prevents the disease before its occurrence. So that is what prophylaxis is. Now, there is a controversy comes in. Of course, homeopathy is born with controversy. What is a pair? The person who runs away from controversy cannot become a winner in homeopathy. You can see the quotation, page number 56 footnote. First year students also, they know. Master's quotations you can see. Don't strain yourself reading the entire text. You can go to the bold one. The universal vaccination puts an end to the epidemic of that deadly, fearful smallpox. Heinemann accepts that the vaccination universally given to all the patients all over the world, it has put an end to the smallpox. But Heinemann still is doubtful, he was doubtful, but to use human morbific matter as a remedy for the same human itch or for evils arised therefore is dash. This dash you will see in Organon of Medicine, both 5th and 6th editions. So Heinemann was still doubtful about the efficacy or reliability or the credibility and or the safety standards. You can see that safety standards, how reliable it is, whether it will produce any evil effects afterwards. So Heinemann is having a question mark regarding the universal vaccination by allopathy. Now it has been later in 1828, the 4th edition of Organon, we have introduced chronic diseases. Heinemann gives another concept, reclassification of miasms, where he added accessory miasm. What is this accessory miasm? Along with the protective matter, the vaccine also contains some disease producing method, to make it simple. I'm not going to the theory. So these concepts were told by Master Heinemann regarding prophylaxis. Application of prophylaxis. Homeopathy is opposed, according to Stuart Close, to the methods of vaccine and serum therapy. Please remember, Stuart Close is considered as a scientific homeopath. You know, in all my presentations, those who are following me in the previous webinars, they know well that I support the scientific aspect of homeopathy. Stuart Close is considered as a scientific homeopath. Okay, so but in spite of that, he has a quotation, homeopathy opposed to methods of vaccine and serum therapy, making it precise, but it opposes the method of applying because it is no way related to homeopathic principles. Yeah, another master from your portion, I'm not going anywhere else, H.A. Roberts. The first chapter, whoever read the H.A. Roberts first chapter, you all know, we have a debate, controversy on vaccination therapy. Again, I told you, we homeopaths are divided. Right from the beginning, we are a controversial subject. On serum therapy, on vaccine therapy, we are divided. Some people accept it as homeopathy, some people call it as isopathy. So what is our stand and how practically you can use it? Please, all of you remember, Heinemann launched Organon not as a practical subject. Okay, so homeopathy was born as a practical subject. It is a theory of cure, not a theory of disease. So theories doesn't matter to us. We directly born out of practice. See, these concepts are very clear to final year students and doctors by this time. Boniasen and Herring supported vaccinosis. A miasm develops after vaccines, allopathic vaccines. Dr. J. Compton Burnett. Remember, Compton Burnett is an allopathic doctor. Okay, so of those times, and he has written a famous book, a very small book. Dr. Kopikar, the pioneer in South India. Okay, I'm a fan of him. He supports this book, Vaccination and Cure by Tuja. He says, Arababa, go and read those books. You have a lot of theory available. So for the juniors, I'll say, please read. It's a very, very small book. It will take only 1 or 2 days for you to read. Vaccinosis and its Cure by Tuja, written by Compton Burnett. It gives a very beautiful explanation regarding how to approach the controversial subject, vaccination. Okay, and final year students and second year, third year clinical classes, when you go in Metra Medica, we have quotations. bad effects of vaccination. Repertories, if you open up, we have around 20 to 50 remedies to cleanse the system, which is having side effects of vaccination, silicea, thuja, sulfur, melandrinum, megeridum, antimtat. The list goes on, heparsil, unlimited. So your theory is accepting it, right? And pioneers also learned. The senior doctors, professors, okay, they have learned and they are called vaccinosis. It is a miasm developed out of the bad effects of vaccination of allopathy, which is very closer, according to them, to psychotic miasm of Hahnemann. So two conclusions we have done here. Though it is a controversial subject, though some doctors invite vaccination, though some doctors reject the vaccination, in our practice, consciously or unconsciously, all of us, we are applying or antidoting the vaccination. If you don't agree in organon philosophy, at least in your Mater Medica, you are applying it. Now, as I said, we are born with controversy. We cannot run away from controversy. We have to answer the controversy, because until unless we clarify ourselves and our minds, we cannot convince other people, other personalities, other systems of medicine that homeopathy is highly scientific and practical. Yeah. The proof of pudding is in eating. I told you, theories you have done in your learning sessions. Now I'll present a beautiful case of autism in my practice. Organizers, you can feel free that I've taken permission from the patient. That's why I'm mentioning his name. The baby's name is Akshay. He's 5 years. He is actually hailing from New Zealand, Auckland, a place. They belong to Chennai actually, but because of his condition, they are very rich people, oil merchants, and they have shifted to New Zealand only to take care of their autistic baby, because I learned from them that New Zealand government is giving free treatment to autistic babies. So it was diagnosed by them when the baby was 3 years old, and they shifted to a special school and they kept him under therapy. So along with therapy, homeopathic treatment was started. So during the case taking, when they visited my clinic in Chennai, so what I learned is, you can see the symptoms. All of them are obviously the symptoms of autism, autism spectrum disorder, ASD symptom. So according to them, after administering vaccination, so we are not giving the conclusions here. Whatever the case is there, I am presenting you based on the history. According to them, after vaccination, the symptoms are developed. So based on the symptoms, I started treating them with diphtherinum, parotidinum, thuja, acid night. Periodically, I have administered them. And you can see the vitamin C, multivitamins, magnesium, vitamin B6 were administered daily. Yes, I am giving supportive therapy also, because there is a theory that autistic babies, they require these vitamins on regular basis. And the therapy was continued. The baby is still going to the school, special school. And Dr. Shanai, Prakash Shanai was telling now that we need some Compton Burnett organopathic remedies in support, because after practicing homeopathy for years, everyone will agree single dose constitutional remedy is not universally applicable. Whenever any case comes to you, we have to understand the case first, whether it is acute or chronic. If it is acute, instantly you have to respond. You have to treat the presenting complaints and reduce the suffering of the patient first. Because even Hahnemannian method, acute totality is different and chronic totality is different. Acute case taking principles are different and chronic case taking principles are different. Now here, autism is considered to be a sensorial or neurological behavioral disorder. So we have kept under Bacopa Moneri mother teacher. I asked the patient to take 5 drops twice a day and gradually increased it to 10 drops. I'm happy to share this because I have taken permission from the patient, but the patient's mother was a little hesitant to share the videos. She has sent me a lot of videos before treatment, after treatment. The difference was really, I'm very happy with the case. I'm handling a couple of cases, autistic cases, but this one I can declare as successful. The first one is the WhatsApp message you can see, the grandfather of the patient who is staying in Chennai, he collects the medicines and sends it to them. He has shared this. There was a tremendous improvement after giving the intercurrent remedies. See, the basis of prescription I am going to share next is, the presentation is all about this, today's presentation. All I did was just antidoting because the patient shared after the vaccination it might have developed. It's not substantially reduced. Okay, so all we did is DPT, OPV, BCG, kind of vaccinations were antidoted as per our homeopathic principles intercurrently. And Bacopa was kept as a principal remedy regularly to keep the patient's brain functioning in a healthy order. And the right side WhatsApp message you can see it is shared by the patient's mother who is staying in Auckland, New Zealand. And she was so happy that baby started doing all his functions, daily activities. Previously, he was unable to eat on his own. Okay, the mother has to run behind him. Now he sits with a spoon beautifully. Maybe I'll try to take the patient's permission again. I'll try to share the videos in the next session if allows anywhere. So beautifully he's taking food now with a spoon. He was unable to sit in front of puzzles. Now he sits on his own and beautifully he has a set of puzzles and he does it on his own with a simple assistance from the mother. So his concentration has improved. Okay, he started listening. This is what the message shared by the patient's mother and grandfather. The next one I am very proud to share with you. The patient's Akshay's trainer, who is also a Tamilian, hailing from Tamil Nadu, and she's settled and she's a tutor in New Zealand, Auckland. Okay, and she has shared the progress of the child after starting homeopathy to the patient's mother. You can see that. Now they are so happily ready to promote the baby Akshay to the next level of classes. Okay, and not only that he is doing his work, he started moving with the other classmates. He started helping the classmates also. So the socialization has to develop, which is the main centrality of autism, lack of social behavior. Most of the autistic people are in their own world. Okay, we can't judge them. Now the social behavior started improving. So such a beautiful result it has come. Their parents, grandparents were so happy. Now grandparents says whenever he video calls his Akshay, okay, he responds, he smiles and he has a social smile. He recognizes, he calls them Tata, Pati, kind of things in Tamil. He started interacting with them. Such a beautiful improvement. The patient is still under treatment. We are happy to share this case. And as a student, when I was a student and when I was reading Organon and Metromedica, I used to say every time, all homeopathic doctors, only work they have, all homeopathic literature, the only thing that does is criticizing allopathy. I feel personally, if Heinemann would not have done so much of criticism, we would have had allopathic doctors easily into our system. Okay, the criticism, of course, it was needed, I agree that, but that has made a little damage to develop a bridge between allopathy and homeopathy. But as far as vaccination is concerned, even allopathic doctors themselves have divided among them. This is allopathy controversy. Most of the doctors, senior doctors, they know about it. What is the controversy here? The evidence, historical evidence, the internet is filled with it. There is a doctor called Dr. Wakefield, okay, with a team of his practitioners. Okay, he started and he created and he published an article in the Lancet on the MMR controversy. According to him, the MMR vaccine is responsible for increased number of bowel diseases and autism in the world. Okay, this has created a great storm among the medical field, and of course, pharmaceutical companies are very worried about that MMR hypothesis. Okay, so of course, WHO has conducted so many trials privately. They have ridiculed it in the later years, but there is a set of doctors and there is a set of people even protesting against compulsory vaccination all over the world. Even parents associations are protesting against it. There is another hypothetical controversy, thimerosal. This, I think most of you people know about it. The thimerosal is a medium, preservative medium, okay, which keeps or which used as preserving the vaccines inside. Okay, and this thimerosal, the aluminum compounds and mercurial compounds which are present in them, they are obviously neurotoxic. And according to this hypothesis, when you inject vaccine into this newborn baby, the fresh neurological system of few people who are either you call it as idiosyncratic or hypersensitive or whatever name you give, allergic, those people may develop adverse reactions or they may develop toxic effects. And this causes autism spectrum or this causes increase in the incidence of autism in the later years. And what they support is, even my age, when I was a child, I think from there it stopped, 1970. Prior to that, the first WHO immunization schedule in India, it was consisting of only 8 to 9 vaccinations were introduced. But recent years, if you go and search the vaccination schedule of any newborn baby today in India, you have a hell of a lot of list of vaccines. The other hypothesis is that, the third one, the increase in the number of vaccines that we started adding into immunization schedule resulting into autism because this causes all these parameters which the MMR hypothesis and thimerosal hypothesis might have produced, might have. Okay, so still the conclusion is not given, but as far as today's stand is concerned, WHO is ridiculing this and pharmaceutical companies are still continuing that vaccines are safer. And that analyze for the student's sake. Go for the bold one. As a microbiologist student, you study antigen antibodies. Antigen, anything which is capable of producing immune response. So an antigen is administered into your body, it's supposed to produce antibodies in your body. So that is what the designed upon. So vaccination is what? Any process of producing the antibodies in your body. Very good. So far, so forth. Again, your microbiology says the immunization can happen in two levels: active immunity, passive immunity. Active immunity is what you get from the nature directly. Passive immunity is what you induce artificially. To make it simple, this session when antigen is introduced into the body, antibodies are produced, and obviously there is a chapter in microbiology book. Antigen antibody complexes automatically happen. This is the nature. Now I want you to understand. Today I'm going to limit myself to one segment. It's a big broad subject. How the vaccination can produce vaccine. Because master has told it, pioneers have advocated it and supported it, and we started applying it. So I have to support it, that's all, my opinion. So you can see antigen, antibody complexes. According to microbiology, whenever antigen, antibody complexes are joining, there is a component, or in the serum, a protein component, which we call complement. The complement will not get activated until antigen antibody complexes are formed, and it will never get utilized until antigen antibody complexes are utilized. Don't worry, I'm not going to teach complement fixation. I read it in second year only. I'm just reminding you people, This is what the one you have read in your second year microbiology classes. Test. There are so many pathways. So what is this complement for recalling? It is nothing but a protein. Okay, we have named them C1 to C, not based on the according to the fixation, but according to the discovery, how they are discovered. So C1 to C9. Around 30 types of protein fragments are there. Okay, 10% of globulin of the blood serum contains of complement. It is synthesized in the liver. Okay, well and so good. Antibody complexes are fixed. The complement will go and join and it will try to create a cascade, which leads to phagocytosis, inflammation, cell killing, and totally the complex is digested. Antigen. So, what is the logic here? Antibody complexes will not. So, what does it will do? Complement. It joins the antigen antibody complexes. It kills the bacteria cell wall. Activating the mast cells and basophils. Phagocytosis. So many things follows because of this you have studied. There are various types of complement fixations. Today's presentation. Serum is a complement. Okay, even if you immunize it, the complement is blood serum, protein serum, and by immunization, antibodies you may develop. You may help in increasing the antibody production, but complement is not improving. It will take its own time to develop. Now the question remains, if you keep on giving booster doses, if you keep on increasing the vaccines to the babies, and if the antibodies are produced, which are demonstrating good, well and good. But what happens to the antigen antibody complexes that are formed? They are not digested because complement is not formed. What happens till that period? The complement develops to the antigen antibody complexes. This is taken from textbook of microbiology. Now, even in allopathy and microbiology, you know, not only just it is utilized, even some people are sensitive enough genetically or by acquired methods, some people are deficient in complement. Some people, they don't have complements at all. You can go through the list. I don't want you to strain your brains. So, be deficient either by genetically or congenitally, or like certain diseases, or excessive usage of complement because too many antibodies are produced. This is taken from microbiology. Now there is a correlation, right? Increased complementation, activation or utilization may be happening because of too frequent or too many vaccines of today's schedule. And classically, SLE people are overuse the complementation very faster. These are the other disorders where the complement very faster. So usually they have excessive usage of complementation. Can you see the list? And complement deficiency can be specific also. I told you there are C1 to C9 fragments of complement proteins. The patient may be either devoid of the entire C1 to C9 or he may be devoid of selected complements also. Like C1 only is missing, or C2 is only missing, or C3 or C4 is missing. So, however, microbiology, we know that hypersensitivity reactions are there. Just for example's sake, I'll limit to type 3 hyper, where antigen antibody complexes. Our book says Hashimoto's thyroiditis, where thyroid stimulators are running in your are not digested and they are constantly stimulating your thyroid, and excessive production of thyroid results because of the antigen stimulation. This we call as type 3 hypersensitivity reaction. Example, Hashimoto's thyroiditis. We know easily control Hashimoto's thyroiditis. I have one case. She is from Salem actually. She was taking treatment there. Somebody recommended. She is very active. She went there, and the treatments continued. She used to receive the medicines by courier. Now periodically she recommends me and she sends me the reports. The TPO antibodies level has reduced dramatically. Her symptoms are also reduced now. And what I did is initially she was under allopathic treatment. I slowly started tapering the medicines. I was giving initially homeopathic medicines along with allopathy. So homeopathy has a very good scope in such cases. These are the list of complementemia where the reduction of complement is there in the blood. You can see most of them are common varieties we generally acquaint in our day-to-day practice. Yep. Now, by this simple understanding, we can understand that homeopaths or the pioneers or Heinemann was well ahead of his contemporaries. So microbiology came into existence as a medicine only after the death of Heinemann. If you go and see the history as evidence, I think the previous presentation I gave evidence, historical evidence. Heinemann could judge the bad effects of vaccination or the side effects of vaccination well before the allopathy controversy or MMR hypothesis, whatever has happened. So we have to hail Heinemann for every concept. That's why one of my seniors used to say, the more allopathy progresses or more the science progresses, the better will be the evidence for homeopathy. Only thing is, we homeopaths have to become scientific. We have to keep our eyes open, but we are becoming Heinemann dogmatists in my opinion. So what is the treatment in for such hypocomplementation? They give as usual immunosuppressants or keep them under supplements, painkillers, antibiotics as a preventive precautionary measure. But as I said, homeopathy, and every homeopath would have come across so many cases. What is the answer? So many cases I can give you, but I'll try to present one or two. Yeah, this is a case of a small baby. The history goes like that. Her mother, the baby's mother, was my patient. She was having SLE, and she was also having some fungal infections along with that because of SLE complication. And after during the treatment of 1 year, the symptoms have disappeared. The patient was improving well. I could brought her out of allopathic medications and all. And they asked me, can I go for pregnancy? I said, yeah, you can carry on with it. But they were hesitant, okay, because the mother was having the problem. I said, no problem, you can carry on with it. We'll see whatever happens. So she became pregnant and she gave a delivery. During the pregnancy, I generally don't attend pregnant ladies with homeopathy, whatever criticism you do, because that will in turn trouble the patient. The gynecologist may not.
Sir, I think
Yeah, am I online?
Yeah.
Is it visible, doctor?
Yeah.
yes, sir.
Yeah.
Please make it slide
Yeah,
share.
I'm extremely sorry. Some problem.
No. Yeah.
No problem, sir.
We'll close it. We'll close it faster.
Yeah. No problem. Huh?
Yeah, I was about to enter into homeopathic methods. Yeah. Am I audible, doctor?
Yeah. Continue.
Yeah. So as I concluded, the complement fixation will give us some idea about there is something, there is fire, and whatever is there in our vaccination method, which we are pioneering. Heinemann pioneered even this criticism also. So we have to hail Heinemann as a pioneer in this controversy also, which including homeopathic doctors and allopathic doctors, all of them are considering about. Yeah, this was the case I was talking about. The baby came to me when the baby was 5 years old. She developed a severe eczema. You can see the pathetic condition of the baby. The video will explain it properly. The rashes were so reddish. Okay, so the baby was unable to even lie down or even wear the clothes, always rubbing the hands, rubbing the head, kind of irritation she was having. Okay, so based on the history, the mother was having the SLE or autoimmune disorder, or the baby has developed eczema, and I treated it for around 4 to 5 months. The credit I give to the parents who patiently waited without applying or visiting any allopathic skin specialist. So I give credit to the patients in this case. You can see the next photo. The baby has grown up very well. Okay, and now the skin rashes has disappeared. And such similar case happened to me. I'll tell you that congenital corporeal constitution concept of homeopathy. See, even today, including Dr. Richard Hughes, some people doesn't like the theory of Sura. Okay, they criticize. Even today we have. But sometimes in our practice, you may be forced to believe in such cases. Example, I had a family of eczema cases, dermatitis cases. Mother was having dermatitis. Grandmother was also having eczematous eruptions. The entire family is having eczematous eruptions. And this lady got married to a person who is not having any disorders. He was relatively healthy. And the baby was born. The baby's name is Navneet Krishna. He's my regular patient. He has grown up now. He's around 10 years now. When the baby was born, Navneet Krishna was born, the same similar eruptions have developed all over the body. And the parents brought the baby to me and they asked, Doctor, can you do something to it? I said, see, we have a philosophy. Whenever anyone develops skin eruptions, we say development of skin eruptions is a good indication. According to Hering's law, center to periphery it will go. And as long as the sora is present on the skin, that means the problem is on the skin, your baby will be hale and healthy. The only thing is you cannot expect your baby to be a Johnson baby. Usually we expect our baby's skin to be so smooth enough. They laughed at it and they said, we know the baby is going to suffer because everyone at home having the same problem. So based on that, I kept hepa sulfur alternatively as the intercurrent remedies, and I treated the baby regularly. Now Navneet Krishna is free from all the diseases. And you know what? Like approach number 281 footnote Heinemann says, 80, I think 87 or 86. If sulfur is given to the pregnant lady continuously as an intercurrent remedy, the baby will be free from sora. It's a hypothesis. Yes, everything starts as a hypothesis. It is our homeopath's fault that we are not doing research on that. We will develop it. So it is our duty to make the hypothesis into proof. Fine, this is my expectation. Now, Navneet Krishna is free from any epidemics that we have today. Even the entire family members get chikungunya. It happened in 2007 November in Chennai. He was free from attacks. Dengue happened. He he was free from attacks. So it's only a single case. Single case doesn't make any law, or it cannot be taken as a proof. So we have an answer for bad effects of vaccination, and this is another beautiful case. Unfortunately, I don't have photographs. It's a case of a Muslim lady, 23 years, of course married earlier. She had a baby. When second time she got pregnant, so she became pregnant. She didn't come to me. She was not my patient regularly, and in her severe urticaria all over the body during pregnancy, and the right eye and the lips swollen enormously, severe itching was there, and the attending physician in institution, SRM Hospital Medical College in Chennai, and she said, if the same condition continues, you're already a silly patient and having the severe eruptions, you may have to terminate your pregnancy. And she came to me. I treated her with Artica urens and Apis mellifica. I have a water dose. Every presentation I'll tell you. Only 2 pills, yeah, centesimal potency. Also, in 10 spoons of water, she has to dilute, and 1 spoon every 1 hour. 24 hours, it has disappeared. Okay. So systemic lupus erythematosus lady, and she is under treatment now. I am treating her with Heparcel, Artica urens, and Thuja and acid nitricum according to vaccinosis theory of Burnett. She is under my treatment now. She is free from attacks. Of course, her delivery was good. It was attended by the same DGO, lady doctor. And the news is the lady doctor's mother is having rheumatoid arthritis, and she is my patient now. Okay, after seeing this result, the lady doctor called me, and she's a professor in SRM college. And she said, what medicines you give? I said, Artica urens and Heparcel. She said, what is that? I said, you won't understand it. And I said, I have given in water dose. You don't even believe it. You don't call it a scientific doctor, but we believe in this. So you can take it as a belief system, whatever it is. Result always speaks. I even repent. I would have taken the photograph. I don't have the photograph of that lady. Now we have vaccination alternatives. As I said, we can treat, we can even give a prophylactic treatment. Since now I am entering into the theory, I'm just jump it out, doctor, I'm closing it. These things, you know, you have studied in your organon. We have prophylaxis methods. Broadly, we can classify them into general prophylaxis and specific prophylaxis. General prophylaxis is giving anti-miasmatic treatment as recommended by Heinemann to a pregnant lady. Constitutional treatment is selecting a constitutional remedy to either to the pregnant lady or to the baby, newborn baby. Because a constitution full-fledged develops after 18 years. Because endogenous and exogenous factors constitutes the constitution. So newborn baby cannot have her own constitution. This is my opinion. Specific prophylaxis we have been applying today, genus epidemicus. We have a specific remedies for specific diseases. So this every doctor knows about it. I'm just jumping over the slides. One news for you. In Sairam Homeopathic Medical College, where I am working for around 20 years over now. After writing the book in 2009, I have recommended immunization card to my principal sir, and he has taken my word, and we have introduced this immunization card, schedule card from homeopathy. This method was winter and last year method for specific constitutional prophylaxis to the baby. According to Winter and Gastier, they recommend sulfur, sepia, carboage, arsenic, belladonna, lactasis, nitric acid, silicia, thuja, lycopodium, graphitis, calcarea, and phosphorus in the same order to be given to the newborn baby periodically. And according to them, if you administer, the baby will be free from most of the infectious diseases and they develop sufficient prophylactic immunity. And we have started it. The response was so big. It was very beautiful. And they started asking geriatric prophylactic card. Patients started demanding. So this we applied it. It's still under process. We are following this in Sairam College. People who want references for this, You can go to my book, A Comprehensive Study of Organon by Dr. Nagendra Babu, BJN publisher, or you can even go to the renowned, very important book, Dr. A.K. Das, textbook of Organon of Medicine.
Dr. Nagendra, these medicines
doctor.
are given which potency?
30th potency, sir.
All
According
medicines,
to Gastier Winter. All medicines.
all in 30.
All in 30 potency, single dose.
Okay.
And the selection of dose and repetition of dose can be left to the physician, in my opinion, because depending upon the baby's or mother's susceptibility, he can select the dose and potency, repeat the doses. Of course, in this method also we have a lot of criticisms done by Boning-Asson. Specific prophylaxis, I need not to take much time, you know it. Specific remedies for specific diseases, even done by Heinemann. Example, camphor, cupromet, veratrum for cholera kind of. I have taken just for presentation sake, I have collected. Students can take a screenshot of your reference. Yeah, specific prophylaxis was even practiced by Heinemann, which you know. Even today we are doing arsenic alpha 30 for corona, COVID-19. So I hail Heinemann. I am a Heinemann in homeopathy, I will say. Though I use specifics, even specifics were recommended by Heinemann. Thank you, doctor. Thank you for giving me the opportunity.
Thank you, Dr. Nagendra. I think some one or two questions are there. If you could have to see the chat box. Otherwise, this 30 potency, the what month for the babies were to start and the experience you have seen.
Dr. Nagendra Babu.
Yes, sir.
Thank you.
You stop sharing, Dr.
Yeah, shall I carry on, sir?
No, you can sharing. You can stop,
please.
Sharing, you can stop. Then we can see one or two questions are there.
Yeah. Yes, sir.
See, 2-3 medicines we are giving. No, the according to that, some whether it is a complementary or intercurrent on what basis that has been decided. Any explanations are available?
Yeah, I know like most of the criticism, such criticism comes. I'm out of it now because if you follow my previous presentations, you can understand what I was talking about. When I said parotidinum and diphtherinum was given, I am not giving them together. Remember, I am not giving them together. And as I said, we have to move away. The picture is changed. I have proved in several occasions that even Heinemann given specific remedies. Even Heinemann, Dr. Boning-Asson, Dr. J.T. Kent has given 2 to 3 remedies in single prescription, but the rule remains one remedy at a time. But there is a dilution that we are doing in our day-to-day practice. I'm openly telling you. Along with the indicated dynamic remedy, we give supportive adjuvants now like mother tinctures. Okay, usually this happens in acute prescriptions, which I do practice.
The pediatric cases, what month we start with this vaccination prophylaxis? Somebody has asked, Dr. Trupti has asked that.
Yeah, usually I advise it after 1 month. After 1 month, because initially any checkups or any congenital deformities or any other problems are there, the initial visits of pediatrician will be done. And after that, you can proceed with if the baby is relatively healthy.
Yeah.
We have started it, madam. It's almost so many years we have been running this. The response is tremendous.
Okay, that has been recorded, and because that will be a very good research product for homeopathy and supporting thing, and such epidemic or endemic or a pandemic situations, I hope you will show some interest to have a proper record according to the CCRH standards.
We are doing it, sir, but it is a college product.
No, it's all right. But, in coordination with them, then only they will accept it. No.
Yeah. We are doing it. Actually, our medical officers are so cooperative. They are doing, and they have a record of it.
Thank you very much, Dr. Nagendra Babu. You are with us and we shared your valuable time with us. On behalf of KQHDA, I think we are very pleasant to hear you. I think this is a beginning. We have to hear many things from you because your thought process is little different from the others, and all they are very happy with that. Now I request our patron, Dr. B.D. Patel sir, to give his
She
concluding.
has muted my face. She doesn't want to see my face. Dr. Tripti,
Sir, you can yourself.
I am trying to open up. She is not allowing me.
No, sir, you can. I didn't do it.
Thank you. Now you permitted. अरे ठीक है भाई.
Yes, as well as
My face may not be as good as Nagendra Babu यार. फिर भी कोई बात नहीं. बुड्ढे को देखा करो कभी कभी. Nagendra ji, this was really a what do you call a new thing. Why new thing is an old thing, but it should be implemented. A homeopathic prophylaxis. Do you know what is the number of vaccines that are advised today?
As per
That means you are still beyond me. You are older than me.
no. As I started, yeah.
45 vaccines for the child
Hmm.
over the period of 5 years.
They
And
come with a
if
booklet.
If a child is now given this 45 vaccines, then the hospitals don't need any more patients. They'll be lifelong.
Obvious.
sir, sir, I will tell you that is the route entry of the infection to the body, and they enjoy it.
Exactly. I remember vaccine. Afterwards, tuberculosis, after they came. Today it is 45. And there is a policy of these pharmaceutical companies. They are approaching government of India, like America. The parents must submit a report that all the vaccines have been given. Now imagine what will be the fate. If you remember, there's a big book called as Vaccinosis, the reactions and the side effects of vaccine. So maybe future, of course, we need to educate our own doctors on the side effects of vaccines. Anyhow, Nagendra Babu, it was a very good one and
Thank you.
nice case presentations.
Sir, Dr.
Unfortunately,
Prakash is also with us. Sir. Please, Dr.
And
Prakash.
yes, sir. Dr. Prakash also, he gave a lot of things on what you call classical approach of homeopathy with miasmatic background, with miasmatic prescription, non-miasmatic, acute, chronic, which everyone should follow them. And as far as my only request, as far as possible, let us stick to one medicine. If somebody gives a biochemic or a mother tincture, I don't think that may much interfere with that. But the basic symptomatology should be calling for one medicine, and potency, it depends upon the individual case and individual doctor. And with this, I thank both the speakers for a nice presentation, and I should thank our president for catching hold of good, big fishes and bringing to our small KQHDA, tank, and making them live here and making us here. Thank you, Dr. Sripad Hegde.
Thank you, sir. Thank you very much for your praising words and appreciating these speakers as well as encouraging us. Now I request our Dr. H.L. Swami to give a vote of thanks because, and my sincere request, Dr. Nagendra Babu and Dr. Prakash, this is the beginning. I hope again we will keep in touch with you and we'll have some more sessions.
Obviously, it is continuous.
Yeah.
Good evening, everybody. Yes, sir. Good evening, sir, for starting and concluding the session. And I thank our President, Dr. Sripad Hegde, sir, for vote of thanks and conducting this one. I thank immensely for today speaker, Dr. Prakash Shennai. The moment when I heard Dr. Shennai, I thought he is from Mangalore side. So in Karnataka, we have a lot of Shennai, sir. So he is on the on the border, other side of the border. So it was a nice presentation, Dr. Prakash Shanai sir. So
Thank you, sir. Thank you.
And today, either incidentally or coincidentally, both are organ teachers. Both are organ teachers, and so generally, all organ classes will generally happens after the lunch. So today also after the lunch, we had 2 organ teachers, but fortunately, none of us, they did not allow us to sleep. That is the best part of the organ teacher.
Thank you, thank you.
And I thank I thank Dr. Nagendra Prasad. He looks like a Tamil or Telugu film hero. So very smart. So very smart. So and even his lecture was smart. So we may differ with the application, but KQHD has history in allowing different thoughts, different school of thoughts to be given the platform. And here what we say is, let us listen to everybody. Let us take the best out of them, and you implement in your practice what is best, what is right for you. So he is right, and he told why he is right, as rightly told. So at least one thing is very clear: is he never give 2 medicine at a time.
Of course.
That is the best part of it. But frequent repetition of the drugs, some medicines, sometimes we may have this one, especially the no sodes, 2 no sodes at a time. That is his experience speaks. Okay, but we can take from each and everybody's experience and adopt according to our needs. So, but it was live, and both the organ teachers, it's good that they started, with the cases, and they try to give the organ class with the cases. That's why it was very interesting. So I thank both the speakers, Dr. Nagendra Babu and Shanai sir. Thank you very much. And I thank Dr. Tutti Pai for coordinating this, and I thank Dr. Chirant was coordinating, and I thank Dr. Chaitali and Dr. Deepa Rajay, and I thank all the office bearers of KQSDA, Thank you one and all who are all attended, doctors, on the evening of that Sunday, precious Sunday afternoon. You all joined, made this webinar successful. Thanks one and all. Thank you very much, sir. Thank you.
Thank you. Thank you, Dr. Swami. Thank you. Thank you for all good wishes. Okay.
Same to you, sir. Thank you.